Propafenone Comprehensive Drug Monograph. Nutter 1. Generic name, drug class, brand name, dosage forms. Generic name, propafenone hydrochloride. Drug class, Class C antiarrhythmic agent, sodium channel blocker. Additional weak beta-adrenergic blocking and calcium channel blocking properties. Brand names, Rhythmol, immediate release tablet, Rhythmol SR, extended release capsule. Dosage forms, immediate release oral tablets, 150 milligrams, 225 milligrams, 300 milligrams. Extended release oral capsules, 225 milligrams, 325 milligrams, 25 milligrams. Intravenous form, available in some regions, not commonly used, primarily oral. Number 2. Definition: propafenone is an antiarrhythmic medication that acts by altering the electrical activity of the heart to stabilize cardiac rhythm. It is used to treat life-threatening ventricular arrhythmias and to prevent episodes of atrial fibrillation flutter in patients without structural heart disease. 3. Mechanism of action. Primary: potent blockade of fast sodium channels, phase 0 depolarization, in myocardial cells, slows conduction velocity and increases QRS duration. Secondary: beta-blocking activity, non-selective, reduces sympathetic stimulation, slows heart rate, and decreases AV nodal conduction. Calcium channel blocking effect weak, decreases automaticity and conduction. Electrophysiologic effects: slows conduction in atria, ventricles, and his Purkinje system. Prolongs PR interval and QRS complex. Little effect on repolarization. QT interval unchanged or slightly increased. 4. Therapeutic uses. Control and prevention of symptomatic paroxysmal atrial fibrillation, PAF, or atrial flutter in patients without structural heart disease. Suppression of life-threatening ventricular arrhythmias, e.g. sustained ventricular tachycardia. Management of paroxysmal supraventricular tachycardia, PSVT, in selected patients. 5 indications: documented, sustained, life-threatening ventricular arrhythmias. Maintenance of sinus rhythm in patients with recurrent paroxysmal AF/AFL without structural heart disease. Off-label, PSVT in selected refractory cases. Number 6, contraindications. Absolute contraindications include structural heart disease, e.g. heart failure, left ventricular dysfunction, cardiomyopathy, myocardial infarction within the past 3 months, uncontrolled congestive heart failure, significant bradycardia, sinoatrial disorder, AV block without pacemaker, marked hypotension, severe obstructive pulmonary disease or bronchospasm, known hypersensitivity to propafenone. Number 7. Precautions before taking this medicine. Cardiac monitoring required, ECG, QRS, PR interval monitoring, before initiation and during dose titration. Liver impairment, propafenone is metabolized hepatically, dose adjustment required. Renal impairment, use with caution, though less affected than hepatic clearance. Electrolyte imbalance, correct hypokalemia or hypomagnesemia before use, risk of arrhythmia. Pulmonary disease, may worsen asthma or COPD due to beta blockade. Elderly patients, greater sensitivity to side effects, especially conduction disturbances. Drug interactions, metabolized by CYP2D6, CYP3A4, CP1A2, high potential for interactions. 8. How to use, take exactly as prescribed. Immediate release tablets, usually every 8 hours with consistent spacing. Extended release capsules, every 12 hours, swallow whole, do not crush, chew. May be taken with or without food, but should be consistent in relation to meals. Therapy initiation should occur under continuous ECG monitoring in a hospital setting for safety. Number 9. Dosing information, adults, immediate release tablets, start 150 milligrams orally every 8 hours, increase to 225 milligrams every 8 hours if necessary. Maximum 300 milligrams every 8 hours, 900 milligrams a day. Extended release capsules, start 225 milligrams orally every 12 hours. May increase to 325 milligrams every 12 hours, then 425 milligrams every 12 hours. Maximum 850 milligrams per day. Hepatic impairment, reduce dose to 20 to 30% of normal. Renal impairment, use with caution, monitor closely. Number 10. Misdose and overdose. Misdose, take as soon as possible. If near next scheduled dose, skip misdose. Do not double up. Overdose symptoms: severe hypotension, bradycardia, cardiac arrest, seizures, convulsions, ventricular arrhythmias, wide QRS, asystole. Management: supportive activated charcoal, inotropes, pacing, IV fluids. No specific antidote. Number 11. Stop or avoid taking. Do not discontinue abruptly without consulting doctor. Rebound arrhythmia possible. Stop immediately if worsening new arrhythmia, severe bronchospasm, signs of hepatic failure, severe dizziness, fainting, or syncope. 12. Side effects common: dizziness, fatigue, headache, metallic taste, nausea, constipation, blurred vision, mild dyspnea, serious, proarrhythmia, new or worsened arrhythmia, Torsades de Pointes is rare but possible, AV block, bradycardia, heart failure exacerbation, severe bronchospasm in asthmatics, liver injury, hepatitis, jaundice, agranulocytosis, rare but life-threatening. 13. Vital information. Black box warning, FDA, only indicated for life-threatening arrhythmias. In patients with non-life-threatening arrhythmias, the risks outweigh benefits. Must avoid in patients with structural heart disease, increases risk of sudden cardiac death. ECG monitoring essential during initiation and dose adjustment. Dose adjustment required for poor CP2D6 metabolizers, higher risk of accumulation, toxicity. Temperature 14. Drug interactions. Drugs that increase propafenone levels, CYP inhibitors, fluoxetine, paroxetine, sertraline, SSRIs, amiodarone, quinidine, ketoconazole, itraconazole, ritonavir, cimetidine, erythromycin. Drugs affected by propafenone inhibition, warfarin INR bleeding risk, digoxin serum digoxin levels, metoprolol, propranolol, plasma concentrations, excessive beta blockade, cyclosporine, tacrolimus, drug levels. Drugs that decrease propafenone levels, CYP inducers, rifampin, phenytoin, carbamazepine, St. John's wort. Summary: propafenone is a class IC antiarrhythmic used for rhythm control in atrial fibrillation flutter and life-threatening ventricular arrhythmias, but only in patients without structural heart disease. It works by blocking sodium channels and has additional beta blocking and calcium channel blocking activity. Due to significant risks of proarrhythmia and drug interactions, it requires careful monitoring with ECG and liver function tests. Thank you. Have a nice day.